So if you want to get started, I really appreciate you taking the time.
All right, thanks for having me. Yeah, so I am a board certified sleep physician, and really what my focus has been on is helping families achieve restful sleep, specifically moms like me, so high achieving, busy moms trying to do it all, and their children. And the reason why I've geared my programs and a lot of the work I do to that age group is that I realize when, from the get-go, when a baby's not sleeping, then mom's not sleeping. And then fast forward to the teen years and things are changing. Most of the time, we're not really hearing much. It's like, oh yeah, we sleep train them, and then yeah, good luck, and so really there's not much out there that's addressing sleep in that, post preschool age all the way to adults. And then as adults, we're trying to figure out why are we not sleeping well? And some of these issues actually date way back. And so again, that really prompted me to start to focus a lot of my work empowering moms to empower their teens, as well as empowering teens as well, because we know that the fundamental habits that we build now is definitely going to serve us later. And that's hence Restful Sleep MD.
Nice. What brought you to the sleep side of things from your, doctoral choice?
Yeah, so it was a personal one for me. I think, right from medical school, the narrative of sleep was not even there, right? You are so boastfully talking about how you slept only 4 or 5 hours. First, there was no time because the training is very rigorous. So I struggled with sleep deprivation. And then on top of that, I had insomnia because I had a lot of worries, anxieties that I would bring to bed with me, So it was just this whole, honestly, it seemed like a blur now because and it turns out, when you don't sleep well, your memory is impaired. I'm like, it was awful. I can't really remember the details. And then I got through, right? I made it through. And I, then roll in my kids who, of course, didn't read the memo and they also didn't sleep well. So we were up trying to, do all sorts of things, trying to make sure they slept well. My son actually had reflux. So and on top of that, I was now working as a doctor. So it was a combination of so much that left me drained, exhausted, unmotivated, anxious. And, I was able to get through that with some strategies I had to put in place, with setting boundaries, with working on insomnia, which was something I was struggling with. And then, as I worked in my practice, a lot of times I would have moms come in with their kids and the child is not sleeping, but then mom just starts off talking about how exhausted she is and things. And I realized a lot of and then when I see them back in clinic, it's like, yeah, he's sleeping so much better and I'm sleeping so much better. So it was like, oh, yes, this makes sense. When you fix the child's sleep, you're fixing mom's sleep. So then I realized I needed to sort of step out of the four walls of the exam room. And so that really led to a lot of my work, connecting with people, collaborating, teaching, creating courses, speaking, coaching, because I knew that this is huge. We have billions of people on earth and people are not sleeping. We need to change this narrative. Sleep is a superpower. And so that was how I kind of made that transition. One really mainly driven by some of my personal struggles and the fact that I was a whole different person once I figured out how to sort of harness my own sleep.
Wow. Wow. That's amazing. Well, and I love, you kind of talked about before we got started that, the high performer aspect of this, right? Where you have all that anxiety, that stress, you're trying to compress and you're working off of 4 hours of sleep. And, we have
Mm.
so much of our society that kind of touts that they only worked off of 3 hours of sleep and just kept going, and they're able to get a lot done, but then the insomnia aspect of that it causes from that repetitive cycle, that you now have to break is just immense. I think
Yeah.
so. What
Yeah.
are kind of your top three tips for I mean, obviously there's the kid side of it, but parents, if they're wrestling with that sleep issue, because it continues past once you've gone through your course and fixed your kids' sleep, that you're going to
Mm-hmm.
now struggle with it to some extent.
Yeah, yeah. And you know, the thing about it is it's ages and stages and seasons in life, right? So we have periods in our lives where something stressful happens. You may have figured out, how to get your sleep better. You may be prioritizing sleep well now. You may have dealt with, insomnia in one way or the other. And then something happens, right? You move, or there's a change in job, or there's a loss of a loved one, and then it kind of rears its head again, the anxiety and the stress and all that just triggers that insomnia again. And I think the important thing about what I do also is really empowering folks with the tools to move forward past that. And that's what I usually say when people are at the end of my program, to say, listen, this is not like one fixed it all done. You'll have times, you'll have seasons when things will change, and you just have to go back to what you know. And depending on what is going on, that's how we really decide on how do we move forward. And one of the things I usually will tell people is there are two different things going on. A lot of times we're sleep deprived, right? Some of those who are sleep deprived may have insomnia, but sometimes it's just insomnia. And insomnia is different from sleep deprivation, right? Sleep deprivation means that you have no sleep opportunity, either because of behavioral issues, right? Either because you're not prioritizing sleep, or you just don't have the opportunity because you're stressed. There's like multiple things you're doing at the same time, and sleep is just not able to be a priority, or you have an underlying maybe medical condition or sleep condition like sleep apnea or things that's now fragmenting your sleep, and because of that you're still sleep deprived even though you may have been in bed for 8 hours, right? But for insomnia, you have the sleep opportunity, right? It's like, okay, I'm going to get into bed at 11 p.m. And then you get into bed, and then a switch turns on and you're tossing, turning, tossing, turning. So the opportunity is then there. In fact, some people with insomnia are in bed for 9 hours and they can only boast of sleeping 5 hours. So really, you can tell that that's kind of different. And I see a lot of our like moms, a lot of our high achievers struggle with sort of a combination of both, where they've hardly been able to prioritize sleep, and then they get into bed and then, they're just not able to sleep. For our teenagers, I think most of them, for instance, may have sleep deprivation. And that's because of so many reasons. One reason is because their biologic clocks have changed. And so they have this sort of delay in their sleep phase, so to speak. So naturally, melatonin, which is sort of that sleep hormone, is produced at, in the evenings, for instance. And then for teenagers, by the time they're going through that adolescent period, or that change, that puberty, I'm sorry, they then tend to have sort of more of a later time to fall asleep. And so they're not getting into bed early. Most times, even if they get into bed at 12 midnight or 1 a.m., most times they're able to sleep till morning. The only problem is they have to get up to school early for early school start times, right? So it's like they're getting shortchanged at the beginning of the night. And then in the morning, we're kind of trying to get them out of bed at 6 a.m. or 5 a.m. When they're in their deepest stage of sleep. And so you can see why for teens, I feel like a lot of them are more sleep deprived. Some of them may have anxiety, and so they may also have insomnia, but a bulk of them, it's basically sleep deprivation because of a combination of those physiologic factors, as well as the fact that the school system does not support their physiology. And then on top of that, the screens, right? So many things. Um, and I think, to come back to your question, I think regardless of what the cause is, there are a few things that I recommend that we just start with. It's like these are building blocks. It doesn't mean it's going to fix all your sleep problems, but they're building blocks you want to consistently follow. And the first is consistency. Literally, like set a bedtime, set a wake up time, and stick to it. Try not to move too far on the weekends, because we have this internal clock, our circadian rhythm, that's really relying on consistency that we can train. So once you can do that, it takes doing it over and over again, setting up an accountability system, whatever you need to do, try to stick to it. So that consistency is key. The second thing I recommend doing, again, regardless of what's going on, is having some kind of routine. especially like we talked about, you're that sort of high performing, or you have a team that's high performing, right? They're doing they're in some kind of sports or team, or they're playing instruments, or they're trying to get good grades. Regardless of that, I think that routine, those bedtime routines are not just for our babies, right? Even we as adults need to have some kind of routine. So have a routine. And that routine doesn't have to be something complicated. It's just a way to transition you from that busy go, 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 go experience you've had all day to a point where you can say, okay, the day is over. Let's ease into the night. And so this could be like, taking a shower or a bath or reading a book or journaling, something that just really fills you, and sort of fills you in a different way. So that's routine. The other piece that I always say is your environment, like your sleep environment, regardless of what's going on. You want it to be cool, you want it to be dark, pitch black as much as possible, and noise free. Again, I say that because cool, our core body temperature tends to drop. The environment being cool, being dark, I'm sorry, the environment being dark has to do with really helping that melatonin, that darkness hormone, to just really to have the production be as robust as possible. Because when our brains see light, our brains don't know whether it's daytime or nighttime. Our brains see light and think, oh, it's daytime, I guess, and so that can disrupt our sleep. And then the noise free. Now, this can come in different forms. Some people don't like absolute quiet. It may be having a white noise machine. It may be having something that you're listening to that's calming, relaxing all night long. Whatever that is, really making sure that there's a consistent pitch across the night. And then another thing I always recommend is sleeping only in bed and avoiding using the bed for other things. Now, our bed has become our gaming room. It's become our office. It's become our dining room. It's become our movie theater. So then your brain that makes associations is like, wait, what are we doing today? What are we sleeping? Are we worrying? Are we playing games? Are we talking? Are we working? So you want to associate your bed with sleep and of course sex, right? And so that's something that I think is really key. And I see that in a lot of people with insomnia where they're in bed and they're tossing and turning. And so the bed, you now develop what you call this conditioned arousal, where your bed becomes this place where you're like, okay, I'm going to get into this bed now and I'm going to just worry, right? We don't want that. We want your brain to think bed and sleep. So doing only sleep when you're in bed is going to help strengthen that association. And then technology, right? I mean, that's a whole show on its own. I think most of us know the impact technology has. It can help our sleep to some degree, in the sense of, if you're not someone who struggles with sleep and you use maybe a sleep tracker or a device that helps you kind of maintain those healthy habits, that's fine. But then when it comes to doom scrolling at 11 p.m. or engaging in or playing video games or things like that, again, that creates this arousal system that makes it really hard for us to go to sleep. And then, I know you said three, but I had to throw this all in there because they're all so good. And I think the last one, okay, is that's the things we know already. Caffeine is a stimulant. Alcohol makes you sort of fall asleep, but it prevents you from staying asleep. So really just checking some of those habits are very
Chocolate.
important.
Yeah.
Exactly. Yeah. Yeah.
Yeah. Any of those stimulants that keep you
Mm-hmm.
awake. So with you have a teens course for helping
Mm-hmm.
teens sleep. And when someone's going through that course, are there sections that most people are jumping to that really helps them kind of off the bat, or is it kind of a seamless flow where we're talking about building those pillars of and foundations of sleep habits, and then
Mm.
crossing that off? Because I've talked to some sleep doctors and they're like, if they're a dentist, they're like, we're going to have a sleep test, right? Because we've got to check your airways and certain things. If it's someone who's a sleep coach, they might be looking first at an overall, like, what are your labs saying, what is the sleep test saying, what are a handful of things saying that give me a place of Is this a medical condition to go see a specific doctor, or is this a something where it's a habit that we need to reform?
Yeah. So for my for the sleeping teens course, really my focus is helping to empower our teenagers to know exactly how to own their own sleep power. Because one of the things I was hearing a lot was they don't listen. I can't get the phone out of their hands at night. They're in bed all night. They don't know what to do, or they're going around in the middle of the night eating snacks. They're hard to wake up in the morning. So I wanted to empower, I wanted something to empower the teenagers so that one, they understood why sleep is important. So those are some of the things that we go through. So we sort of establish an understanding, because one thing I realize is when people know better, they do better. Like most times what I'm hearing my moms say is, well, we're fighting at night. And it's like, well, that's a very stressful situation. So number one, you as a mom is not going to sleep. Your teenager is upset, is not going to sleep. So that's not going to work. Or I'm trying to get the phone out of their hands. And sometimes it's like they need the phone because they can't fall asleep. And so they need something to distract them from their racing mind. So all those things, there is a reason, right? We talked about their physiology. So they get into bed because mom asked them to get into bed at 8 p.m. and they can't sleep. And it's 10 p.m., it's 11 p.m. They're frustrated. And so they get the phone because they're trying to distract themselves. So we talk through, why is that happening? So that they don't feel like they're the ones that are doing wrong. Their bodies are just not ready to go to sleep. And so from there, from that place of understanding, I provide like, okay, these are some strategies that you could use to fall asleep in a way that's healthy instead of falling asleep on your phone, right? So we then go into, this is why mom keeps saying you should do this. Mom's right most of the time, but I'm here to support you so that she doesn't get the bad rap all the time, right? So we kind of walk through why, we talk through like, one of the other things. Essentially, I listened and then I created this course to answer those questions and those struggles. So they can't wake up in the morning. They seem to be like dead asleep it's hard to get them out of bed. And so we go through, okay, these are the things that I would recommend we do to get your day started better. So I would recommend shifting some of your routines to the beginning of the night instead of the morning. So essentially, really practical things in bite sized that they can then take away and act on. And then, there's some, I have a worksheet that goes with it. So that intentionality of writing and making observations about their own sleep. So it becomes their own. They develop that autonomy rather than relying on their parents to help them on this journey.
Very cool. Very cool. So uh what is someone, like what do you most commonly find that is a parent and they need this course? Like what are the things that the handful of things that they're saying where they're like, yeah, I really just need this course, to help get my teen into that routine.
It's things like my teen is struggling during the day. That's a common one.
Okay.
So either they're sleepy, or they're not focusing in school, or their grades are sleeping. My teen is not motivated. Things like it's hard to get them out of bed in the morning, or it's like walking on eggshells. They're so crabby in the mornings. Or my teen just doesn't sleep, does not sleep at all, does not sleep. That's another one I hear. But it's hard. I think they do sleep. I think the issue is that the parents have already gone to bed, and then the teen is sleeping probably later at night, right?
Yeah.
So those are some common things. Of course, if you're the other one of the modules I also talk about is when you need to go to see a sleep physician. So my capacity in this course is as an educator, right? I don't know them. I do not offer direct medical advice, but I say these are things that you need to speak to your doctor about, because if you're snoring every night, it might be sleep apnea. If you find out you're getting enough sleep, you're still super sleepy during the day, and you're having, sort of like these episodes where with emotion you're dropping, it might be narcolepsy. So we go through those medical conditions, so that if this is not just a behavioral related thing, then we want to make sure you get this addressed by a professional. So that's kind of how I've built it.
Okay. So what are the top things, top three things, top five things that someone knows that this is a behavioral or this is a medical condition?
Yeah, different things really. So medical conditions sort of fall under the bucket of, again, the most common reasons why people don't sleep. Obstructive sleep apnea, where they don't sleep well. So the symptoms that follow obstructive sleep apnea, it's a lot of like the snoring, gasping, choking, maybe restless sleep, waking up really unrefreshed, even though you've had a relatively normal number of sleep hours. For a lot of our teens who are maybe overweight or they have big tonsils, they are at risk of that. If you have restless leg syndrome, so in that situation, it's that creepy crawling feeling you're having in your leg. So if they're having those symptoms, then it's not behavioral, right? They're in bed and all of a sudden they feel like they need to keep moving their legs. So maybe that's restless leg syndrome. And then there are things like narcolepsy, which is really actually relatively common in teenagers. And that's around when it's frequently diagnosed, where they have this irresistible urge to sleep and also have some other symptoms like cataplexy, which is really loss of tone that's triggered by emotion. They may have hallucinations, sleep paralysis, things like that. So all those symptoms are pretty dramatic. So most times, the reason why I have that on that course is, oh my goodness, this is what's going on, then they could at least call the attention of their physician. Because if their physician is not of course, if they don't have a sleep physician in their lives, the doctors may not naturally ask for those symptoms. So what I hope this course will provide is a guide to say, well, if you're having this symptom, it is not normal. You need to seek help. So that's what it is. And then insomnia, it's not a medical condition, but it's a sleep disorder where you have had a period of time where you've had difficulty either falling asleep, staying asleep, or you're waking up super early, and it's affecting your daytime function. So there's some strategies that I can offer that I do provide to help you with that. But then there may be some other issues that we may need to address with either a sleep physician or a psychologist or things like that to help with what you call cognitive behavioral therapy for insomnia. So those are more of the medical. The behavioral things are around habits, right? Around, the devices, not having a routine, around sleeping in and sleeping randomly, taking naps, around caffeine, around staying in bed and doing everything in bed except for sleep. So which is why I take you back to that, sort of my kind of like checklist of things you should follow, because a lot of those issues really help address many of the behavioral issues that come up.
Very cool. Well, I really appreciate your time today on all of this. And I think it's left people with a lot of great information as far as I'll include in the YouTube link below a link to your courses so people can go right there and check out with them. If is there anything you want to say as kind of a final note on all of this for parents or
Yeah.
kids? Yeah.
Yeah, no, absolutely. Thanks for having me. So I would say just continue to prioritize sleep. I'm just so excited about the work that's being done out there because there are very few of us who are doing this work still. There's still a need. And so I really applaud you, Jeff, for taking this on as well, because we do on this, we're starting to understand how important sleep is to life. There's a lot of information on exercise, which is critical to sleep, right? On good diet, which is really important to sleep. But sleep is a very critical pillar of health. And so when we prioritize it, then all these other things get better. And so I want to encourage folks out there, if you're a mom and you feel like you're doing all the things and nothing seems to be working and nobody is sleeping, that there is help. Just feel free to reach out. My website is restfulsleepmd.com and we could just have a chat. as well as I'm on Instagram and also on LinkedIn. So you can reach out to me at Restful Sleep MD and really let's get you sleeping.